My expectation of National Rural Health Day from a rural perspective is that those folks will just go to work and take care of people the way they do every other day. But that broader awareness is the important thing as far as I'm concerned, that everybody else takes a few minutes to recognize and acknowledge the contribution that rural health providers play in the broader system of healthcare for everyone.
We know coming out of the pandemic, in a lot of cases, those rural hospitals actually functioned as the public health infrastructure in their communities. They were certainly the front lines of dealing with the pandemic, but they also provided testing, vaccines, other resources for their community. So we know that without those hospitals, we wouldn't have made it through the pandemic. It just reminded us what a critical role they play in the fabric of this state. Certainly our urban hospitals relied on them for discharging, for resources, to be a partner in the community as well. So all of those things, I think, showed us the value of those hospitals, and a day to remember that is extremely important.
Well, I believe that every Texan matters and deserves the same healthcare services and has the same needs of our urban communities. Sometimes the challenge of low volume or lack of resources can become make these rural hospitals less viable, but it doesn't make what they do any less important.
I think we've got several priorities that we want to remind our policymakers, members of Congress, members of the legislature, that they can be supportive of rural hospitals. The first is financial stability. We really need to ensure that rural hospitals have the payment stability to make sure they can deal with the needs in their community. And certainly, we also need help related to workforce. And when we look at the workforce pipeline, the legislature has certainly made significant investments in the workforce pipeline, but we need to make sure those resources get allocated appropriately to our rural hospitals. Another big priority is behavioral health. And again, a lot of times behavioral health resources are more strained in rural areas. So we want to make sure those resources are appropriately targeted.
Rural hospitals are literally 5 times more likely to close than their urban counterpart. And so we just need awareness of their vulnerability and support, frankly, from our state and federal elected officials.